So there are several applications of AI where I see the AI directly influencing the care pathway, whether it comes to priority interpretation or whether it comes to priority communication with the physicians.
I'd love to. So Lung Impact is, I think, one of the only prospective multi-site randomized trials to look at the impact of artificial intelligence triage of abnormal chest x-rays on the time to diagnosis of lung cancer. We're processing, I think we've processed our first nearly 10,000 chest x-rays from the three trial sites, and that's expected now they're fully online to ramp up quite quickly. So we're quite confident that as the further sites come on board and our accruals go, we'll be really well powered to find out how we can best identify patients who need our urgent care.
So if I'm doing a lung radiograph or a radiograph of the lumbar spine, I can notice things that AI, particularly Qure's collection of AI, and be able to provide that kind of additional opportunistic care.
I don't look at AI as replacing the radiologists. I look at it as us making us better radiologists, and I'm not scared of AI as much as I embrace it to help make me a better radiologist.
The AI can work in a lot of ways. I mean, in terms of sort of case detection, picking up edge cases, picking up serious cases, but in particular, and I think Remy sort of alluded to that improvement in workflow time, especially that time as brain phrase is really critical in stroke. And so being able to optimize both the detection of potential cases for thrombectomy, for urgent interventions, and get those images to the decision makers really quickly, and as part of a sort of wider kind of ecosystem and an IT ecosystem. And that's already been shown to be beneficial in stroke, and I think that's very much here to stay in that pathway.
Because what we've seen from artificial intelligence in general is that it helps a radiologist who's a generalist get up to the level of a subspecialist, and that's what we could really use.
And most people forget that there are rural settings where there's a significant absence of expertise. And AI is a really excellent opportunity, at least when it comes to diagnostics, to bring that expertise to them, whether it's shortage of expertise, I would say even the top level expertise that you could get in a city, you could get right over there. There's also a global component, as you can imagine, to rural. Different countries have different pressures. And sometimes we forget that there are parts of the world where people have no access to a radiologist, right? So even though a lot of times, of course, we aim for perfection, there are parts of the world that having a 80% or 90% accuracy is far beyond what they're getting. And we should not forget that AI actually could be a real interesting way of bringing that care to those parts that otherwise would not have that level of care.